What are the X-ray findings you see here? On the left-hand side, you see X-ray chest PLU with multiple cavities with the fluid levels. On the right-hand side, you will find cavity on the left mid-zone, very thick walled cavity with a fluid level, again lung abscess. So one X-ray is multiple lung abscess, other is single lung abscess. What is a lung abscess? A cavity filled with fluid is called lung abscess. What are the common causes of lung abscess? X-rays has to be interpreted in the background of the history. Someone comes with a history of very short duration, recent onset, think of acute infection. If somebody thinks of chronic cough, think of TB or cancer, chronic infections. What is the cutoff for acute and chronic? Arbitrarily, 3 months can be taken as a safe cutoff. So more than 3 months, you think of malignancy, autoimmune diseases, chronic infections. What's the closest differential diagnosis for a lung abscess? One is bulla, second one is cyst. And how you differentiate between them? If the thickness of the wall exceeds 4 millimeters, you think it is a cavity, and if it is less than 4 millimeters, you think it is a cyst. When a cavity is filled with a fluid level, you call it a lung abscess. And bulla classically have no walls, you have air-filled spaces adjacent to the chest wall. The common causes can be classified into infective and non-infective causes. Infective causes can be acute and chronic. Acute can be bacterial like pneumonia. Improper use of antibiotics, wrong diagnosis, shorter duration of antibiotics may lead on to abscess formation. Streptococcus pneumoniae, staphylococcus pneumonia, Klebsiella pneumonia all can land up with lung abscess. Fungus infection, histoplasma, coccidioidomycosis, cryptococcosis, aspergillosis are causes for lung abscess. When you come to the chronic infections, tuberculosis tops the list. Nocardia can also be there. Parasitic infections like paragoniasis, echinococcus can also be causes for lung abscess. What about TB producing lung abscess? Tuberculosis classically produces cavities but not with fluid level. Presence of fluid level usually points to lung abscess, but if you are suspecting tuberculosis, then 3 possibilities are there. One is already existing cavity with second infection, or endobronchial tuberculosis preventing the coughing out of contents of the cavity to the bronchus. And third one is if there's a bleeding just before you take X-ray test, you can have a fluid level. Non-infective causes, of course, top on the list is bronchiolitic carcinoma. Then comes autoimmune diseases like Wegener's granulomatosis, rheumatoid nodules breaking down, sarcoidosis. Congenitally, you can have area of sequestration and bronchiolitic cyst. Trauma may lead on to areas of blunt injury, contusion, hematoma, breaking down cavities possible. Multiple cavities or lung abscess characteristically indicates that there is a common source. So it can be a septic embolism. Septic embolism usually come from right-sided walls. In a person with tricuspid wall endocarditis, scenarios like septic abortion or intravenous drug use can lead on to tricuspid wall endocarditis, and vegetation can be thrown out. It can lead on to multiple areas of pneumonia, breaking down, producing cavities and lung abscess. The X-ray will show multiple cavities. The first X-ray was a crude case of melioidosis. Whenever there's a multiple cavity, think always about sepsis, septic emboli, or tricuspid wall endocarditis.